Imagine that your child is diagnosed with a complex heart defect. Suddenly you are thrown into this complicated and unfamiliar world. The cardiologist uses a pen and paper to thoughtfully draw a diagram to describe the changes in your child's heart and all the surgeries that would be needed to fix it. Despite this hand-drawn sketch, you feel confused, overwhelmed, and take to internet searches to try to understand what all this means. You find yourself struggling to explain it to your family and friends. For some of you, this may be all too familiar. What if there were a better way to empower and educate children, families, and trainees alike with better visual resources? The 3D Heart Project has worked over the last 3 years to create learning tools designed to show families and trainees what a real heart with congenital heart disease looks like. We mean what it actually looks like. We can go beyond a drawing to replicate a patient's heart by taking their CT scans and turning them into a 3D model. These 3D printed and digital models create educational experiences that are unique and embodied. They help level the playing field between novices and experts by providing an opportunity for clarity through visualization. Our vision is to improve the understanding of congenital heart disease by creating an open and freely accessible educational resource using 3D models to better the education of patients, families, and trainees. We have already successfully created several digital and physical models of congenital heart defects. To achieve our vision, we need to improve these educational resources and make them openly accessible. Firstly, we want to make our 3D models better. To make the defects easier to understand, we will integrate color to communicate blood flow and mixing. This will allow learners to appreciate how the anatomy and physiology interact in congenital heart disease. We will take the digital files of these colored heart models and make them freely accessible through an interactive website. Users will be able to 3D print these digital files from home, work, or their local library. We will create a series of videos explaining the individual models that will be targeted to patients, families, and medical trainees. We will package the colored 3D printed models into educational kits and distribute the kits to WCCHN sites for teaching healthcare professionals and families across Western Canada. Finally, we will evaluate the quality and impact of our teaching materials using focus groups, surveys, website traffic, and logs of use of the physical models. We will use the discoveries we make to expand this project even further, nationally and internationally. We are asking for $10,000 of funding to cover the 3D model creation and materials, website design and hosting, video creation, and sharing the printed models across WCCHN sites. The funds provided by the Boost Up program will be matched 1-to-1 with generous family donations that we have been fortunate to receive. This will allow the funding to go even further and to be able to achieve the goals that we have outlined. The 3D Heart Project will drastically improve congenital heart disease understanding. Better understanding leads to better care, whether that is a more expert team, a parent who feels that they are the expert on their child's health, or a patient who understands the importance of seeing their doctor. With the help of the Boost Up program, the 3D Heart Project can grow to make a sustainable global difference in congenital heart disease education and care delivery.